Welcome to Take Another Look, a current events and public affairs show bringing you news you can use. There are so many different types of diets, so much conflicting information about food quality and medicinal treatments, and seemingly every week there's a new threat of a super disease or dangerous epidemic. We have someone here today who is going to help us make sense out of this complicated world of medicine. Her name is Dr. Carla Hightower. She is a health coach and a founder of Living Health Works LLC, and she'll share her expertise with us, which includes ways to use food as medicine and how to prevent disease. Welcome to Take Another Look, Dr. Hightower.
Thank you so much.
Thank you for spending some time with us and coming on out here and sharing your knowledge with us.
Thank you. I really appreciate the opportunity to be here, to share and to be able to express what I think is so important for our community to understand health and wellness. So
let's start first. We're entering into the holiday season. There's going to be office parties, there's going to be huge food spreads, and some people are going to enter into some dangerous levels of gluttony over the next few months. Tell us a little bit about the detrimental effects of eating too much and how that can have how that can impact your health.
That's a great question, and the importance of our diet and our lifestyle choices is really the key. And what we see during this time is that people start to overeat, overindulge, and it's the time when we stop exercising and we combine this period of excess. And diet is so key. It's the most important choice that we're making from day to day. So about 80% of our health is coming from what we actually choose to put in our bodies. And the effect is very rapid. So by the time we have Thanksgiving, just in 1 month, we see an increase of heart attacks, emergency visits to physicians for procedures related to the consequences of overeating. And we find that the #1 day of the year for heart attacks is actually Christmas Day. So the problem starts at Thanksgiving, and we see cardiac complications skyrocket. And by the end of the year, we now have patients coming in for procedures that could have been avoided.
So your background, of course, we know you're a doctor, you're a physician, but you started off in a different area of the medical field than you are in currently, correct?
Yes. I am a medical doctor. And I practiced anesthesiology for 21 years. Okay. So I have the formal traditional training that all doctors have, where we really focus on pharmaceuticals and we focus on mastering the latest procedures and providing excellent acute care for patients. However, when time came for me to choose a second career, I chose to go in a direction that was more holistic. So I started a health coaching practice, and it's centered around food as medicine. And I chose that because 10 years ago, I discovered that the way for me to be personally healthy was to move away from traditional medicine. So even though that was the core foundation of my training, pharmaceutical drugs and go get a CT scan when you have pain, or go have somebody inject you with an anti-inflammatory when your joint aches. That was my training. But when I started to suffer with symptoms of these pains, digestive problems, joint problems.
So it was a medical emergency or medical conditions in your life, your physical condition, that really made it so that as a doctor, you decided to go into another area of the work because of what you were experiencing. Now the doctor had become a patient.
Exactly.
Interesting.
And so what happened was, like patients, my doctors gave me medications, prescription drugs. And as that list started to grow, I wasn't getting better. We would change the dose, we'd order a new test, and it was like being on a merry-go-round where I was spending thousands of dollars with my deductible and doctor visits and not getting well. And so then I experienced a epiphany, really, that these drugs are to be used when you have an acute crisis, but they're not going to help you on a day-to-day basis unless the individual does something to take control over their health. And so that's what I did. I mastered a healthy diet and lifestyle, and it just changed everything.
Now that's interesting that you raised that point, because that's something that leads, I think, to skepticism as it relates to the medical industry and pharmaceutical companies. A lot of people feel like there's an overprescribing of drugs. A lot of companies feel like when a doctor says, take this particular drug, it's because maybe the pharmaceutical company said, you can go on this golf trip with us next week. Or perhaps this particular doctor is referring you to someone who's a specialist in this particular disease so that they can experiment on you or do something that will gain them notoriety in their field or something. And then also because of the conflicting information. You know, one day, don't eat this. Next day, well, this is okay in moderation. Then this one, oh, we thought this was not okay in moderation, but it's totally okay. Eat it all the time. In fact, eat more of it than you have been. Gluten, no gluten, wheat, different things. You know, it's confusing to people who aren't specially trained. And so I think that leads to some of the confusion and, like I said, some of the skepticism when people go to the hospital. And of course, these enormous costs that many people are experiencing when you go, you know, if there's some type of a serious illness that you're dealing with, you're looking into tens of thousands of dollars in those cases. So, am I off track there, or is what I'm saying right now making sense? And is there a solution to that?
Well, first of all, to address your question about doctors
Yes.
and their motives, for the most part, as a physician, we were really trained to have our patient's best interests in mind, first and foremost. Especially doctors like me who were trained back in the 80s, we were always told your patient comes first.
Okay.
So that part, I think, I rest assured and I'm comforted that my physician colleagues had that mindset. However, we were given tools that allow us to excel in acute care. It allows us to give you the best treatment in the world and world-class results if you have an acute problem. But we are weak when the problem is a chronic problem. So for instance, the United States medical system is exceptional and #1 in the world if you have a trauma. So if you're in an accident or if you have an acute event, let's say you're having a heart attack right now and you walk into any emergency room in this country, that's where you want to be. We will keep you alive because we have those resources and we have the doctors trained for that. But what we don't have is a system of teaching people how to prevent those problems in the first place. So how to keep from having heart disease, how to reverse the problem through diet and lifestyle so that if you do have it, it never becomes severe. And we know that food is the #1 tool that we have available. And we can reverse heart disease. That's been proven. Dr. Ornish in San Francisco, the Cleveland Clinic, Dr. Esselstyn, they have documented for us and for the medical community amazing studies that show you can reverse heart disease.
So when you're talking about these types of diseases, you're talking about hypertension, you know, high blood pressure, heart disease, diabetes, these types of things that really, when you hear about our communities, we're really at the highest level.
Yes. And so instead of going to take a medication first, instead of taking medications daily and going back to do the same, eating the same way, or having a sedentary diet, what we need to do is focus on the diet and the physical activity and stress reduction and lifestyle changes first. That should be the core, and that's where the power comes in, because the results are tremendous. Like, for instance, I have a client who came to me with a full-blown case of diabetes with sky-high blood sugars. He was on large doses of insulin. He felt terrible, of course. And in the first appointment, he asked me if there was anything that he could do, anything other than take medications for the rest of his life and still feel sick. So we went through. I asked him if he was motivated to change some of his habits, which is really the key. It has to come from the individual, that motivation. And he learned how to eat a healthy breakfast first. He learned about foods that reduce inflammation. I taught him which foods cause the disease in the first place, how to avoid those, and what are some delicious, healthy meals that can satisfy you and keep you feeling comfortably full, so you're not hungry, so you're not craving the junk food. And once you learn to cook these delicious, simple meals, his blood sugar started coming down. And in a couple of months, he was completely off of insulin, off of the metformin, back to playing golf and thriving. So people can do this once they know how, and they have a compelling reason also.
Now, in some of your materials, I've heard you describe the medical profession and those who are doctors kind of like firemen. Can you tell us a little bit about that analogy that you use with us?
Okay, absolutely. I have a fondness for medicine, and I was well trained. My attending physicians who trained me showed me the best of the best. But the problem is that those skills and tools that we have to use for patients really focus on acute care. So it's that moment when a person's in a crisis, or that moment when they're actually having a life-threatening situation. And it's very much like having a fire department come to your house when your house is on fire, and they save your life. Maybe they can save some of the structure of the home. But what they do not do is they do not come in and do inspections. They don't check your smoke detectors or your carbon monoxide
exits, your lights, things like that.
That's all the individual's responsibility to make sure that all of those things are in place throughout the year, and a fire can then be prevented. So there's no one but the individual to turn to really keep the house from catching on fire in the first place. So medicine is the same way. We are doctors. We're like firefighters. We're there for you when your whole body is inflamed, or you're having a heart attack, or you're having a stroke, or your diabetes is out of control and you need to be hospitalized and kept alive. But we really don't have the tools or the resources to give people day-to-day management. That's on the individual to manage their day-to-day choices that keep them well and prevent diabetes and prevent high blood pressure, because it's all perfectly reversible and preventable, because we know that there are food-related illnesses. So science shows that. So we're no longer confused about the cause.
We're going to get back into that. Are there some things, however, that we don't necessarily have protection against? I mean, sometimes you hear about environmental racism. You hear about the, lead in the water or something of that nature, something that people are dealing with every single day. They have no idea. And then all of a sudden you realize you've been drinking tainted water, or there's pesticides put in the food. You're eating fruit, but it has pesticides. Are there some things that actually are caused by the environment, or is it really something that can be avoided, most of it? Because it sounds like you're saying a lot of it can be prevented by disciplining yourselves. But I just wanted to, because sometimes you do get the feeling that, when you hear of someone maybe who didn't smoke and then they die of lung cancer, or you hear of someone who, you know, just is the paragon of health apparently, and then all of a sudden they have a heart attack or something like that, and just those stick out.
Absolutely. And that's what we're dealing with now. We are dealing with the consequences of industrial pollutants that have permeated, for instance, our oceans, so that something that seems so benign as eating a piece of fish now puts you at risk because of the contamination with the industrial mercury, for instance, or other toxins that are actually in the ocean do affect the food that people eat, and that is something that people may not at all be aware of. The studies, though, are there in the literature. It doesn't take much digging to actually find that evidence, but the average consumer may not really be looking for that, or may not know that what's sold in their grocery store and looks so appealing actually has these risks. So you're absolutely right that the environment is an added source of concern. Air pollution is another severe problem for people. It can cause respiratory diseases. So there are many factors out there, not just food, but we do know that we have a lot of science and data to equip people so people can find out. Like, for instance, we can have water tested. We can find out the results of that water testing in our community. And we can also do things we can take steps once we have that information.
So as we wind down in our final moments here, what are some solutions, just briefly? Okay, so for example, the gentleman you mentioned who had diabetes, if someone is watching right now, what are some simple steps that one can take to help reduce the symptoms of having diabetes?
We always want to go to the root cause of the condition. So that's where you start, with what is causing the problem in the first place. And something like diabetes or heart disease, high blood pressure, what we find is that these diseases have one thing in common: the standard American diet, which is mainly a diet high in meat, animal fat, saturated fat, processed foods. So these are different manifestations of the same root problem. When you address one thing, you often will resolve many different problems at one time. Chronic pain is also related to the standard American diet. So diets that are high in animal products in particular are connected to these diseases: breast cancer, prostate cancer. Very clear. We have information and research that is astounding, that shows the more of the animal products that we eat in our diet and the more processed foods that we consume, the more likely we are to have all of these diseases. And some say that the diseases are not actually different. They're just different manifestations of the same singular problem.
Outstanding. Well, Dr. Hightower, how can someone get in touch with you if they want treatment or just some of the advice that you're giving to us right now? They want to talk further and they're interested?
Oh, I would love that. I am available at my business, which is Living Health Works, and my website is livinghealthworks.com. And my office phone is 312-260-9902. So that's the best way to reach me.
Well, I have listened, I've learned, and I'm sure our viewers have as well. We've been here with Dr. Carla Hightower, who is giving us the opportunity to take another look at medicine and healing ourselves.